Hello Keeners, my name is Jennifer Hayes and welcome to Module 8. Today is October 29th, so happy early Halloween. Hopefully this presentation isn't too scary for you as I will be discussing situation-specific and borrowed theories in nursing. A little Halloween humor for you. I'd like to begin by going through an overview of the topics that will be covered in this presentation. First, I'll review the learning outcomes, followed by the reflection questions for the week, and then we'll dive right into the meat and potatoes of situation-specific theory, followed by borrowed theory. So enjoy! So the learning outcomes for the week were identified by our professors, Dr. Risling and Dr. Vandenberg. By the end of Module 8, we should be able to explain how situation-specific theories advance nursing knowledge and practice, describe how the use of borrowed theories contribute to nursing knowledge, and describe the risks of utilizing borrowed theories in nursing. Hopefully by the end of this presentation, all three of the outcomes will be fulfilled for you, and you'll be excited to start answering the reflection questions for the week. The reflection questions to be answered are: has your point of view changed on the use of borrowed versus unique theory in nursing? Do you utilize borrowed theory in your practice? And what level of theory do you find easiest to relate to your practice? Is there a risk in not incorporating all levels of theory? Please keep these in the back of your mind as you're listening to this presentation and while you're going through the readings. Now, without further ado, let's begin our discovery of situation-specific theory in nursing. Situation-specific theory is also referred to in the literature as practice, micro, or prescriptive theory. They are nursing theories that are used in the hands-on delivery of nursing care to clients. Just as its name suggests, it is theory which is specific to a nursing phenomena, a time, place, and/or patient population. Because of the specificity of the information gathered from the theory, it may not be applicable outside of its initial context. They generally contain few concepts and are quite narrow in scope, and so therefore they explain a relatively small aspect of reality. McEwen suggests that there are common characteristics amongst all situation-specific theories. They are all used to carry out nursing interventions and often lead to the performance of psychomotor procedures or are related to communication. They can be derived from multiple sources such as grand or middle range theories, from clinical practice, comprehensive literature review, research, or a combination. Situation-specific theories combine a set of principles or directives for practice and play a role in testing nursing theories. Nursing practice and the development of nursing knowledge are benefited through these common characteristics. Situation-specific theory may relate to nursing administration or education, or they may cover particular elements of a specialty and typically describe specific elements of nursing care. In our readings this week, we see examples of theory that is specific to the menopausal symptoms of immigrant Asian women in the United States in an article written by Im, as well as perceived access to breast cancer care by African American women in an article by Garmin Bibb. So how do nurses go about developing situation-specific theory? Im developed an integrative approach for the development of situation-specific theory, which is visualized using her flowchart. It is important to recognize that this process does not have to happen sequentially. Different parts of the approach can be happening concurrently or may be skipped altogether if appropriate. There are 4 parts to her approach, and utilizing them will assist a nurse with developing a strong situation-specific theory. The first part of Im's integrative approach is to check your assumptions. These include multiple truths, evolutionary nature of theory development, socio-political contextuality, and nursing perspectives. These 4 assumptions are the basis for the whole theory development process of situation-specific theories. Multiple truth speaks of the understanding that nursing phenomena are complex and there is diversity amongst nursing clients. Therefore, theory development must take into consideration this complexity and diversity, as nursing phenomena cannot all fit into a singular truth. The theory development process is forever evolving, and the norm cannot be predicted indefinitely. It must be assumed that as nursing phenomena evolve, so must our nursing theory. Situation-specific theory assumes that nursing phenomena occur in a socio-political context, and so those need to be incorporated into the theory. Because of this, situation-specific theories are specific to that socio-political context and cannot be applied across all time and place. Developing situation-specific theory for nursing requires the use of a nursing perspective. Without it, the nursing phenomena may be distorted and mislead nursing research and practice. A second part to IM's approach is exploring the phenomena you're wanting to learn more about. Usually multiple sources are used to explore the phenomena. These can include using grand, middle range, and/or borrowed theories, literature review of existing knowledge of the phenomena, personal experiences from research projects, educational programs, and/or clinical practice in a variety of settings, and collaborative efforts both internationally and interdisciplinary. A third part to the approach is theorizing. Initiation is the first step in theorizing during development of a situation-specific theory. It can be initiated in multiple ways by an individual or a group, by one or many sources, and all at one time or at separate time points. The process as well can take place in several different ways, such as literature review, statistics, personal experiences, health models, professional experiences, and/or academic experiences. And then finally, integration of the knowledge gained during the process is used to develop concepts related to nursing phenomena. The final part in IM's approach to development of a situation-specific theory is to report and share the knowledge learned. She states that when the documenting of theorizing and integration takes the form of a manuscript, a model, or a research report, these need to be reported and shared with the nursing communities. This information can then be validated through critiquing of the theory by peers, and the theory can either be refined or developed further. IM's approach gives nurses a guide on how to develop situation-specific theory, which will in turn benefit nursing through the increase of our unique nursing knowledge and guide our practice. It is worthwhile mentioning the link between the development of situation-specific theory and evidence-based practice, as they share many similarities. Evidence-based practice has become widely accepted in nursing as an approach to problem-solving in clinical practice because it consciously and intentionally applies the currently agreed-upon best evidence to direct care for patients. The process of developing and the desired outcomes of both situation-specific theory and evidence-based practice include identifying a clinical problem, conducting a comprehensive literature search, critically evaluating the researched evidence, and determining appropriate interventions. Both are research-based and focus on a relatively small set or subset of patients in fairly narrow defined situations. As well, the desired outcome of both is to develop nursing interventions that can be applied in clinical practice to improve the health of patients. The main critique of situation-specific theories is that they are procedural and not based on a well-developed body of nursing science. However, their use is beneficial to advancing nursing knowledge and practice because they are ready-to-wear theories. Their ultimate goal is to create better nursing outcomes for patients through their specificity and diversity. Because they are easy to apply to nursing practice, they may produce better nursing care outcomes in comparison to theories that are more broad or general in scope. As well, since they are more than just guidelines or standardized procedures for nursing practice, they provide a basis for the development of nursing knowledge through research. It is easy for nurses to get involved with the development of situation-specific theories through the different stages. Nurses can recognize a need for a theory where one is lacking or is out of date. They can assist with the research by doing literature reviews or sharing their personal experiences as examples. They can also review the work done by another nurse and see if the theory he or she developed needs refinement. That concludes the slides on situation-specific theory. So now is a good time to take a stretch break, hit pause if need be, and enjoy the greenery of fall in Florida. That's my little guy cruising around our backyard. I hope you feel a bit more comfortable with situation-specific theories and that you understand how they are beneficial to the development of nursing knowledge and practice. Now, let's move on to the more controversial topic of borrowed theory in nursing. In 1968, Dorothy Johnson wrote an article on borrowed and unique theory in nursing. She stated that one discipline does not own that knowledge just because they discovered it. Knowledge is owned by society as a whole. However, she goes on to stress the importance of differentiating nursing's unique knowledge from that of other disciplines so that we can dispel the notion that nursing depends entirely upon the findings of the pure sciences for application and practice. Let's continue on to explain what borrowed theory is and its applicability to nursing knowledge. Borrowed theory, which is also known as shared theory in the literature, is knowledge which has been developed by other disciplines. That knowledge is then drawn upon by nursing and used to describe nursing phenomena. Nursing education programs have historically incorporated borrowed theories from a wide array of disciplines without a formal or critical examination of the context of the theory and whether or not it is a good fit within the philosophical perspectives of nursing. It is important to point out that in some literature, the term shared theory is synonymous with borrowed theory, and in others, borrowed theory is changed into shared theory when the theory is altered to fit into the context of the discipline borrowing it. A little confusing, I know. Nursing has borrowed and shared theories from multiple disciplines, such as sociology, psychology, the biomedical sciences, administration, education, feminism, and others. Since nursing involves caring for an individual in a holistic way, it is logical to use borrowed and shared theories from this multitude of disciplines. Our required readings this week gave us an example of how the trans-theoretical model of behavior change, which is from the discipline of psychology, was used to develop a middle-range nursing theory, the commitment to health theory. The author evaluated the theoretical model of behavior change using concept analysis to validate its usefulness as a borrowed theory in nursing practice. The commitment to health theory was designed to predict the likelihood of behavior change between the action and maintenance stages of change and can be used in health promotion. This example is one of many where the use of a borrowed theory has served to advance nursing knowledge, but there still remains a divide amongst nurse theorists if borrowed theory should be used. The two sides of the debate on whether or not nursing should use borrowed theory include one side that believes borrowed theory should be used because knowledge belongs to the scientific community and to society as a whole, and that the knowledge developed by any one discipline is not borrowed but shared, and shared theory will not lessen nursing scholarship but enhances it. The second believes that nursing knowledge should not be tainted by using theory from other disciplines because borrowing implies that it must be returned, and so the theory is not in essence nursing if the concepts are borrowed. A further critique on using borrowed theory is that the identity of a discipline is dependent upon the development and use of their own theories. So nursing should strive to rely solely on our own theory to strengthen us as a discipline. There are also risks that have been associated with using borrowed theories. Nursing can lose our identity as a discipline because our research can be misdirected in attempts to define concepts or phenomena through the lens of another discipline. It can create confusion in the meaning of concepts, as each discipline may define a concept differently. For example, empathy techniques can be defined as using the right words to stimulate communication, or it can be defined as behaviors that show understanding. Whichever definition of empathy is used, it will guide the research of the concept and can affect its applicability to nursing. If we use borrowed theory, we are creating an incomplete body of nursing knowledge because we are not answering questions that are important to the field of nursing. Instead, we are contributing to the advancement of knowledge in other disciplines. Regardless of which side of the debate you are on and how risky the use of borrowed theory is, the reality is that it will likely continue to be used to increase the knowledge base of nursing. So how do we combat these risks to ensure that it is truly nursing knowledge we are advancing with the use of borrowed theory? The task for nursing is to question its fit and applicability to our discipline before it is adopted for use. By doing so, we can advance nursing knowledge through the use of borrowed theory. As a nurse, we must be confident that our practice is based on theories that are appropriate for nursing situations, and our nurse researchers should examine how borrowed theories can be applied to nursing situations. An article written by Villarreal et al. Demonstrates how we can utilize borrowed theory within a nursing context by linking it with conceptual models of nursing. These authors state that little attention has been given to determining whether the borrowed theories are empirically adequate descriptions, explanations, or predictions of nursing phenomena. By linking the borrowed theory to a conceptual model of nursing, it is being placed within a nursing context and therefore can be considered relevant to nursing and can help advance nursing knowledge. These authors recommend verifying that the world views of the borrowed theory and the nursing conceptual model be congruent so that the two can more easily be linked and thereby create a shared theory. They use the theory of planned behavior, which has its roots in psychology, and placed it within a nursing context by linking it to Newman's systems model and Orum's self-care deficit theory. If you have some free time, this article is an excellent example of how to effectively use a borrowed theory and make it relevant to nursing knowledge and thereby strengthen nursing as a discipline. And with that, we have reached the end of the borrowed theory section. I hope you now have a greater understanding of the use of borrowed theories and how they contribute to increasing nursing knowledge, as well that you are able to recognize the risks of utilizing borrowed theories in nursing. And finally, I hope you are able to recall how situation-specific theories advance nursing knowledge and practice from the first half of my presentation. I wish you all a happy Halloween, and I look forward to facilitating our discussions over the weekend.